Welcome, everyone. Thank you for joining us today. My name is Nicole Gann. I'm a JCRC board member and member of the IGJC, the Israel and Global Jewry Committee. Through JCRC, I feel more connected to the greater Boston Jewish community. When events happen locally, nationally, or in Israel, JCRC provides context, insight, and education. And even before I joined the board, I appreciated JCRC's strong support for Israel and their statements on significant events. Now, as part of the IGJC, I have the opportunity to learn and to talk about Israel, as well as to hear different perspectives and ideas. I look forward to meeting in person again very soon. And now I will turn it over to JCRC's Executive Director, Jeremy Burton.
Thank you, Nicole. And we're very thankful, and I want to start this conversation by appreciating our many partner organizations through Boston Partners for Peace, who have been doing the hard work on the ground of acting as a vital liaison between their communities and the government in Israel in the course of this pandemic. They are an important part of our relationship as a Boston Jewish community to the work on the ground, and we're looking forward to continuing to share their specific stories in the future as we have been throughout the last year. But today, we want to pull back and maybe sort of pull the lens out and look at the wider picture and get a broader overview of how the pandemic has impacted relationships between diverse communities in Israel, with each other, with the government, with the response to COVID, with the vaccination process, and the way forward. I think it's fair to say that all of us here in the United States have sort of observed with some amazement the extent to which Israel has been outpacing the rest of the world in terms of getting vaccines in the arms of people and getting back to reopening. And it was not lost on some of us yesterday when Dr. Anthony Fauci told an Israeli audience that in effect they were reaching herd immunity as a country, something that we are only beginning to hope that we might make it to at some point in this country. So today we want to dig a little deeper, understand what that's been like, what the sense of it is on the ground, and how the vaccine distribution has looked across diverse communities, and frankly, why some communities were slower to receive vaccines and get to a state of normalcy or reopening during this whole course in Israel. I'm very happy to introduce Nathan Jeffay, who will help us answer some of these questions and your questions as well. For the audience, a reminder that you can use the Q&A function if you have questions. There will be time for Nathan to answer them. Nathan Jeffay is the Times of Israel's health and science correspondent. He's been a journalist for 20 years and has been working in Israel or from Israel since 2007. He is an Israel correspondent with the Jewish Chronicle of London, the Jerusalem correspondent with The Tablet, an international Christian weekly. You can read his full bio. We're going to throw it in the chat. Nathan, thank you for joining us today, and please enlighten us. I don't think we can hear Nathan yet.
Okay, can you hear me now?
We can't, there you go.
Okay, it's wonderful to be with you all. Obviously, I've enjoyed meeting with you in person in the past as an organization, but the pandemic opens up new possibilities, so doing this is extremely interesting. We're going to be talking today about the pandemic and Israel, and specifically the vaccination process, because as we were just saying, Israel's vaccination has been something quite remarkable, quite interesting, and it's something that I've followed all the way through. It's something that I've also followed with certainly no rose-tinted spectacles. The pandemic here has been a roller coaster, up and down, and I've followed all of the highs and lows as well. And when we come to questions, you are of course welcome to ask anything you want about Israel and the pandemic and this vaccination drive. So let's get started. Israel's vaccination drive came after really an awful stage in the pandemic, where Israel basically last spring thought that it was over. We really thought that it was over. We really thought that we were done. And then the second wave came with a vengeance. And then we had a third wave as well. And for many days, many days, my job was to write about how Israel was leading the world in the number of new daily cases. The number of new daily cases per million population, Israel was leading the world. That was not a good thing to be leading on. Now we're leading the world for different reasons, and we're going to discuss that. So the vaccination drive here started December 19th, with the Prime Minister, the President, and senior doctors going first. And I, along with a large part of the population, was a little bit cynical about this and thought, well, you know, is it really right for the Prime Minister to be taking the first shot for himself? Is that really the right path? But in actual fact, regardless of any political perspectives, it turned out that was absolutely the right thing to do, because it was leadership by example. Because as soon as he went and rolled up his sleeve, said, I'm prepared to take this vaccine, I'm prepared to take this shot, and the president followed, it really relaxed a large part of the population that thought, okay, here are our leaders taking the shots. If they're happy to take it, we will do so first. And then straight away, we had this massive gathering of momentum. Since then, we have 5,410,000, almost 411,000 people have received the first dose. 5 million have received a second dose. Obviously, that's only relevant if we have a sense of Israel's size. We're talking about a country of around 9 million people with a very large population of under 16s who are not eligible for the vaccine. So those statistics are extremely impressive. We're talking about, and we'll come to the exact statistic, more than 85% of the eligible population, i.e. those who are over 16, have received shots at this point. Israel's leading the world. If you look at this graph, you have an average of 121 shots administered per 100 of the population. Obviously, that reflects the fact that you're meant to take 2 shots of the vaccine. So if the numbers are a bit confusing, it's because the number is always going to be higher than the level of the population. So there you get a sense of how Israel's doing globally. And the really important thing here is the 60 plus population, the population aged 60 plus, who basically have been the most vulnerable all the way through this pandemic. It's the 60 plus that we've been the most worried about. The 60 plus have had the worst rates of hospitalization, the worst responses to treatment. So we could all breathe a sigh of relief when the 60 plus were getting vaccinated in large numbers. And today, for the oldest age groups, we have well high 90s in terms of vaccination, coming down as the age groups go down. But what we've seen is a massive fall in elderly people in hospital, especially. So especially the elderly, as soon as they started getting vaccinated in large numbers, sharp drop in their hospitalizations. Now, let's talk a little bit about some of the difficulties. Israel obviously has a very diverse population. So you're going to have a very different mentality towards health if you are somebody working in high tech, in Tel Aviv, in a crowded office, desperate to get back to normal life. You may well have a different mentality to if you are a Bedouin farmer who lives only with your own family, limited interaction with others. This very diverse population. What I want to do is to delve a little bit into how that diversity has affected the vaccination process. So right at the start, we had a big problem. And the big problem was that middle-class Jewish Israelis were racing to the vaccination stations. In the Arab population, people did not want to go near the vaccination stations because there was a mistrust of vaccines. There was a feeling of discomfort that the government was asking people to do this, and the Arab population oftentimes has a slightly ambivalent relationship with the government, and just hesitancy that we didn't see to the same degree in the Jewish population. And what this created was a very bizarre scenario where Arab or vaccination stations in Arab towns were almost empty at the start. In Jewish towns, they were massively crowded. all of a sudden, WhatsApp groups, Facebook groups, all sorts of groups popped up. And the purpose of these groups was for Jewish Israelis to exchange tips on where you could go in Arab towns where the vaccination stations had loads of capacity. So we had this bizarre, interesting, slightly strange scenario where Jewish Israelis were running around Arab towns looking for vaccines. And in a really fascinating kind of way, this proved to be a really interesting interaction between the communities. And I went around to these vaccination stations as a journalist. The lady that you can see in this photograph with the orange top, she was a kibbutznik, somebody who lives on a kibbutz. She's sitting in the waiting room next to, I think, the only two Arabs who were there in this Arab town, and they're chatting and they're talking. And this lady says to me, the Jewish lady says, you know, I never normally go near an Arab town. I don't go to Arab towns, but I'm here today. And there was this interaction that started, but more important than that, when I spoke to the Arab residents of the towns, here's what they said to me. They said, you know what? We were nervous to come. We were nervous to get vaccinated. But when we saw Jewish Israelis coming to our towns to get the same vaccines, that reassured us. And about 2 weeks after the Arab towns were full of Jewish Israelis getting vaccines, Arab Israelis started to follow in large numbers. So it's really this kind of interesting dynamic of the Arab Israelis actually being reassured by the Jewish Israelis. That said, there is still a lag between Jewish and Arab vaccination rates. 78% of eligible Arab citizens are vaccinated, which is about 10% lower than the equivalent in the Jewish population. That number, the 78%, has actually risen quite a bit in the last few weeks by Arab citizens who wanted to get vaccinated in time for Ramadan to celebrate with their families. And I believe that the Arab population will reach the level of the Jewish population, or very close, pretty soon. It should be said that vaccine availability in Arab towns has been good. There have not been issues of availability when we're talking about the mainstream Arab population. We're going to come in a moment to the Bedouin population, which is slightly more complex. And I believe that that catch-up is going to be happening over the coming weeks. But within the Arab population, there are some sticking points. There are some major sticking points. And the most important of these is the Bedouin population. So Israel has quite a large Bedouin population. Bedouins still tend to dwell in desert areas, in smaller locales than other people. There are some Bedouin towns as well. Not everybody is living a traditional Bedouin lifestyle. So a mixture of towns and small villages or hamlets. And these figures here are really stark. 88% compared to 38% of the population. 38% of Bedouins over the age of 16 vaccinated. Now, if you have a Bedouin village where people are living in very close proximity, a coronavirus outbreak there could be very serious, could spread very quickly among people. And this 38% figure that you see here is a cause of real concern. So my colleagues and I have been looking a little bit into this issue, trying to understand what's happening here. And there is a mixture of factors. So one factor is, when it comes to the Bedouin population, is availability, because they live in such small areas. And there is a further complication, which is that some of the Bedouin villages are what we call unrecognized villages, which means that they are actually considered, and this is controversial, but they're actually considered by the Israeli government to have been built in contravention with Israeli law, which means that some services are not provided there. This creates a very complex situation where some things are delivered by Israel, some things are not, and the provision of vaccines in these areas has been a little bit mixed, a little bit hit and miss. Even beside the issue of whether they are recognized or unrecognized villages, they're also very small villages which tend not to have their own clinic. Now, what Israel has done, what the government has done, is to send mobile vaccination stations there, vans and other mobile stations, in order to try to increase the level. But there have been some issues of availability, some issues of transportation, which are supposedly being dealt with, but that has been a factor in holding back vaccination rates among the Bedouin. There's another major factor, which is mentality. Among the Bedouin population, which tends to be quite isolated, tends to be something of an echo chamber, there is a suspicion, a concern about vaccines, nothing that's grounded in a great deal of rationality, ideas that, and that's not to be disparaging in any way of kind of ideas and ideals in that community, because obviously we have a great deal of respect for that community. We're just talking about on the particular issue of vaccines, there is a lot of misinformation and disinformation going around. It's distinct from the American anti-vax narrative. It's not the same. It's ideas about fertility and putting things in one's body that might cause all sorts of problems, but a very kind of distinct narrative to do with that. This is a quote that a local in one of the Bedouin villages gave to a colleague of mine. There are people here who would rather die than be vaccinated, you know, so very kind of serious suspicion. And there are more than 144,000 Bedouins that are still to be vaccinated. That doesn't sound like a particularly large figure, but in a country of 9 million people, every vaccinated person counts. So 144,000 yet to be vaccinated, and in the past 10 days, only 300 of them got a shot. So this is kind of a major hurdle that Israel needs to overcome. And I think that's going to be one of the major challenges over the coming weeks. Let's talk a little bit about the ultra-Orthodox population. Ultra-Orthodox, or known here as Haredi population. The ultra-Orthodox population has been extremely significant in terms of Israel's experience with the pandemic, because numbers of infections were very much kind of out of proportion to the rest of the population. There was a lot of infections in that ultra-Orthodox population. A lot of controversy here as to why that was. Part of it is to do with circumstances and environment, with people living at very close proximity to each other. Part of it also seems to have been because of a disregard in some, but not all parts of the community for some of the coronavirus regulations, schools operating in some areas when they were not supposed to be, and that kind of put up the coronavirus rates. When it came to vaccination time, there was concern that ultra-Orthodox may be very slow in vaccinating. What we've seen is that by now, 73% of the eligible Haredi citizens are vaccinated, which is 15% lower than the general population. And that is a cause for some concern. I've spent some time recently in ultra-Orthodox areas with low vaccination rates, speaking to people, finding out why, talking to young people who are convinced that they just don't need a vaccine, talking to older people who, there is a small fringe of anti-vax rabbis. I say a fringe because the mainstream rabbinic circles have gone to get themselves vaccinated, but there is a kind of very charismatic fringe of ultra-Orthodox rabbis that are anti-vax. That has played a part in limiting the rates of vaccination among the ultra-Orthodox. A really interesting experience that I had in touring the ultra-Orthodox areas was that I actually went in expecting people to say, you know, if they're not vaccinating, I'm not vaccinating because my rabbi says, you know, not to vaccinate. In actual fact, I heard the opposite, which is that the rabbis are encouraging people to vaccinate, and it's actually those people who are don't have a great deal of reverence for the rabbis, who are basically disregarding the rabbis and not vaccinating because they are worried or they are scared or they've seen something on social media about that. And I think that's a kind of campaign that the government will be taking up quite a lot now that we're going to be vaccinating teenagers, and there's a disproportionate number of teenagers among the ultra-Orthodox population. So the ultra-Orthodox population is a challenge, especially with the teenagers coming in. But in terms of vaccine supply and state supply of vaccines, that is something that's very present in all of these populations, and efforts are being made to get the necessary supplies to them. We can talk a little bit more about that when we come to questions. I want to go back to the main vaccination story now and ask, what is kind of fueling Israel's success? Why is Israel moving so fast, or why has Israel been moving so fast compared to other countries? What's been driving this? A few factors that I've come across again and again and again in covering all of this. Strong vaccine supply. Israel's had a very strong supply of vaccines, actually an oversupply of vaccines. And I think the reason for that is that it was an attractive proposition, supplying Israel with vaccines for the vaccine companies, because after all, they got to supply a small country entirely, or we're actually talking about one main company, Pfizer. Pfizer got to supply almost every Israeli with a vaccine and basically create a success story for itself by doing that, and to really kind of prove vaccines to the world by taking advantage, and I don't say taking advantage in any judgmental way, I mean literally by taking advantage of the fact that Israel is a small country with a very efficient health system that could get those vaccines out, well refrigerated, richer, and really kind of use Israel as an example. Second factor, I think the health system is very efficient, a very efficient health system here, comprised of different health funds that all work with government backing. So the Israeli health system has the strong points of both, say, let's say the British model, which is free at the point of service, free to everybody, nobody being able to say that they can't get a vaccine because of cost. Everyone can get a vaccine, don't need to worry about insurance, it's there for the taking, really based on a British free model. But at the same time, like in America, you have competition between different organizations. So you have 4 different health funds that are actually competing to be the best. And I think this healthy competition actually encouraged them to really strive hard, each of the health funds in their own way, to be as good as they could in getting out those vaccines. So the combination of free but some competition in that system really made things work well. Strong infrastructure, lots of former military people with great expertise in transporting things around at sub-zero temperatures, transporting medications around, all of the logistical side that's so important, done very well here. A motivated population, highly motivated population. When Israelis decide they're going to do something, right, I'm going to go and get a vaccine, they will do it straight away, no messing around, and they'll make sure that they do it. And that has been very helpful in terms of actually pushing people to those vaccination stations. And the last thing here is what I call friar fear. Friar is the Israeli word for being a sucker. If you're a friar, that means you're a sucker. Nobody in Israel, it's the prime value of Israelis, nobody wants to be a friar. Nobody wants to be a sucker. And if my next door neighbor is getting this great thing, a vaccine, then I'm going to get one. I'm not going to be the last person to have it. That's the mentality. And that actually motivated people to get out there because no one wanted to be left behind and not have a vaccine when all of their friends are getting the vaccines. And the last thing I want to mention before we move to questions is, what is the hope for the world here? And just today, a major article, major research came out in the Lancet, the British medical publication, really giving the statistics on the effectiveness of the vaccines. We're talking about 97% effective in preventing death, 95% effective in preventing infection. And what Israel really keeps on doing by generating this kind of data is showing the world that it's practical to administer vaccines to the population, showing the world that the side effects are minimal, and showing the world that the vaccines work. I can see that by walking around Israel, going to a cafe, going to a restaurant, living a relatively normal life. I can see that, but we need that in statistics, we need that in medical research, and that's what's being published now from Israel. And Israel has kind of turned out to be this laboratory for what you could call real-world trials. After the clinical trials, real-world trials, and Israel has been kind of testing this out for the world, illustrating that it works, illustrating the successes, and I also hope illustrating the difficulties, the hurdles, especially what we've been talking about with regard to niche populations and how to care for them as well. So that's an overview, and I'd like to hand back to embark on some questions.
Thank you, Nathan. A lot of information there, and also I think a lot of things that are prompting additional questions. As a reminder to the audience, I see we've already got some to use the Q&A function, and I will try to sort some of that and mix them with other questions that have come in by email and text and all those lovely things flying into the inbox. So Nathan, I want to actually follow up on something that you talked about, the Bedouin gap, and I'm going to connect this to a conversation that's of interest here in the United States, because you framed your presentation like as you ended in this sort of this larger hope and lessons for the rest of the world around vaccination. And clearly one of the issues we're going to have here in the United States, and it's already seen, is about rural vaccinations. And the issues around Pfizer and the refrigeration and transportation to the rural spaces. And there's in this country, there's been some hope and obviously some halting around Johnson & Johnson as a more deliverable vaccine to rural areas. So I'm wondering, when you talked about this Bedouin gap, you touched on some of this, and you touched about the infrastructure the Army has and the mobile stations. How is Israel delivering Pfizer with all of the complexities of it to these rural areas? And is Israel experimenting with some of the other vaccinations in some of these periphery areas of Israel as well?
So the answer is that the Moderna vaccine has been used in the military, and the Moderna vaccine, which is easier to store and to transport, has been used in the military. But in the main, we're talking about use of the Pfizer vaccine. And what is kind of slightly easier about the Pfizer vaccine than we thought is that once it is defrosted, you can then put it into a kind of mobile vaccination, a relatively normal type of refrigeration, and you have a little bit of time with that. So what you can do is start taking out mobile refrigeration to outlying communities, and that's proving quite key in strategies like vaccinating the Bedouin population, etc. I must say that the logistical issue is actually proving less challenging than I expected. I wrote at the beginning that there was going to be kind of major call for kind of all sorts of technology in order to keep things cold, but we've managed that relatively easily. I believe that America will have and does have the kind of infrastructure that is needed for that, and can make that available at relatively short notice. Where this is problematic is when we're talking about things like, I don't know if we're going to come to talk a little bit about the Palestinians, etc., but certainly when we come to areas like that, those logistics are more difficult. But I think in America, I think the time frame during which you can actually move the vaccines around once defrosted will facilitate that kind of mobile vaccination.
Thank you. Thank you for bringing it up. I was actually, the next question was going to be about the Palestinian areas. And I know you didn't reference that in your initial overview, you just touched on it. And, for the sake of our audience, obviously there is an important distinction to be made here between your presentation about Israel and the vaccination process within Israeli citizenry. Clearly, Nathan, it's certainly been covered to some extent, maybe not particularly well in the West, vaccination in the Palestinian areas. So I'm wondering if you could share some thoughts about both Israel's relationship with the Palestinian Authority, how that has affected vaccination distribution in the West Bank and Gaza, and frankly, as we talk about this sort of the achievement Israel has had around vaccination, I know you've written about this, what the impact of that vaccination rate is going to be for Israel's reopening.
Yeah, so I mean, and maybe we should just kind of define our terms as we start, because when we're talking about the Israeli population, we're talking about everybody who is an Israeli citizen. So that includes Jewish populations and Arab populations, everybody who is an Israeli citizen, equal access to vaccines. And then we're talking about the Palestinian population, people who are not citizens of Israel, who live in the West Bank and Gaza. Jerusalem's a little bit more complicated for this, but when we're talking about Palestinians, we're talking about non-Israeli citizens. And then the story is much, much, much more pessimistic. As of last week, only about 3.6% of Palestinians had received one vaccine dose. Only 1% were fully vaccinated, and notably, about 100,000 of those people were actually vaccinated by Israel. About 100,000 of those people are Palestinians who work in Israel and have been vaccinated in Israel. So actually, the Palestinian operation to get people vaccinated is moving very slowly indeed. Is there some controversy attached to that? Yes, absolutely there is. There is controversy internationally. There's also controversy in Israel, and those controversies are quite distinct, because internationally the controversy relates often to rights, responsibilities, the conflict, with people highlighting a viewpoint that they think that it is incorrect that Israel is vaccinating its population, not Palestinians. Within Israel, there is a discourse among health officials, which is that from a practical point of view, is it not in Israel's interest to vaccinate Palestinians because, well, the virus does not know borders. And if you're talking about herd immunity, do you calculate herd immunity in terms of the Israeli population, or do you calculate herd immunity in terms of everyone living in this little slice of land, Israelis and Palestinians? So how do you calculate that herd immunity? And is it not problematic for Israel from a health point of view if Palestinians are not vaccinated, especially given that Palestinians do encounter Israelis through work, especially in settlements, and furthermore, many members of the Israeli Arab population go to Palestinian areas for shopping or to see family. So there's those two kind of discussions going on, one to do with rights and responsibilities, and one to do with practicalities and health provision. In terms of the rights, Israel is going according to what it says is its interpretation of the Oslo Peace Accords of 1993, which seems to put responsibility for vaccination in the hands of the Palestinians. So Israel says that that's the basis for that. On the other hand, there are those voices who are saying, Israel should be doing this, just should be doing this. And in terms of the practical discourse, I think that the hurdles to that are not all on the Israeli side. I think that the Palestinian Authority also is very, very wary that its image might be harmed if it's seen as being too cooperative with Israel. Let's remember, the Palestinian Authority actually rejected medical supplies from the United Arab Emirates because they were flown into Israel's Ben Gurion airport. So, there's politics there on the Palestinian side, and it's unclear, despite friends of the Palestinians internationally saying, hey, Israel should be vaccinating the Palestinians, it's unclear what the Palestinian Authority's stance actually is on this.
Thank you. It's a very comprehensive outline of some of the factors here. I want to move on to other topics shortly, but there's one clarifying question that came up, which is specifically about the, you're very precise with terms, the non-citizen permanent resident Palestinian population of Jerusalem. Where do they fit in the vaccination story? Are they part of Israel's numbers? Have they been vaccinated through the Israeli program or not?
Yeah, so we're talking now about Palestinian residents of Jerusalem, yes, who are being vaccinated by Israeli healthcare providers. And there are a lot of clinics in Jerusalem that have been receiving them and sitting empty for a lot of the time because use has been limited, but use has increased ahead of Ramadan.
Great, thank you. So pulling back out, I think the last time I saw you, actually, now that I'm thinking about it, was December of 2019, when you spoke with one of our study tours when we were in Haifa, if I remember correctly. I think it was Haifa that we saw you that trip. We see you in different places at different times. And, we talked a little bit about the politics. And if I remember correctly, at the time, Israel was then heading into a scheduled third election. And as we're sitting here today, well, let's just say there's at least some speculation that there might even be a fifth election before we here in Boston get to see you next in person. And I'm wondering, in the context of this, electoral, I'll call it chaos, how has that affected the vaccination story, or even actually the entire COVID response story by the Israeli government? Has it impacted the government's ability to respond to COVID, and has there been an electoral impact of that response as we've continued to see, a fourth election in this pandemic?
Yeah, it certainly has impacted things, partly positively and partly negatively. So negatively, let's say, lacking stable government during the management of a pandemic is problematic because it distracts from the task in hand. And I think what has happened is that there is a kind of high consciousness of politicians in terms of wanting to please different populations and please different lobbies in terms of how you manage the restrictions. So, you don't want to upset the restaurant owners, you don't want to upset this profession or that profession and limit their business in lockdown. And what happened was that there was a very kind of unpleasant process of wrangling over different restrictions. Open the restaurants, don't open the malls. No, open the malls, don't open the restaurants, with different kind of lobbies getting involved there. And I think that was probably one of the negative impacts of being in an electioneering time, in the sense that the politicians didn't feel they could be more firm and say, this is what we're doing, this is what makes sense, this is what's right from a health point of view, and to do that. On the other hand, I think that the sense of a looming election certainly did encourage the government, specifically the ruling Likud party, Benjamin Netanyahu, to push very hard on vaccination, because I think he saw it as a major electoral advantage. He wanted to have that vaccination success. So I think that was a factor in fueling the vaccination program, just kind of making it move so fast. I think that was a motivating factor. I think also towards the end of the pandemic, I think generous payments to businesses and to citizens in terms of kind of financial compensation, I think that was also something that, with a sense that there was an election coming up, was a more attractive option for the government. So I think that kind of pushed that forward as well. And in a sense, that made it easier for people to keep by the rules because they were slightly less worried about their finances. So I think things came together in that respect.
Thank you. I'm curious, in that context, that I can't help thinking of, well, first of all, obviously, Prime Minister Netanyahu was not able to get successfully form a government coming out of the election, at least so far. Never count him out. I'm curious because you talked about how he saw it as politically valuable to push the vaccination, to be able to go into the election with a success story. I'm also reminded of sort of the United Kingdom and the elections they had shortly after the end of World War II, and how Churchill did not actually benefit from winning, saving democracy in the West, and then lost an election months after World War II. And I'm just sort of wondering, so did it pay off? I mean, when people actually did go to the polls in the last election, did it help the government? Did it not help the government that that Israel is this success story that it is?
I mean, it's hard to know what impact it had, because it's hard to isolate those factors. look, I mean, we've seen people vote in pretty much the same patterns in all of the recent elections. So it seems that people are pretty entrenched. Everything that we think, hey, that's going to be a major factor in terms of the election, that's going to make all the difference. You know, having a prime minister on trial, or having peace with the United Arab Emirates, or having peace with Qatar, you know, all of these things that you think will be real game changers, in some way people are just kind of very ingrained in their voting patterns. So I think, look, I think that it could have gone either way, because at the end of the day, if Israel was still deep in the pandemic, maybe it would have had the opposite effect to, you know, maybe it would have made people think, well, you know, in the mentality of many people, you know, they need Israel to be in a safe pair of hands, and they would consider that to be Benjamin Netanyahu. Or maybe people thought, you know, given that they're coming out of it, they could be slightly happier with the leadership that we have. In actual fact, the elections indicate that people are kind of pretty stuck in their political affiliations, and everything that we think will kind of be a major game changer just doesn't end up being a game changer. So we don't know what to do about this. I can tell you that my children are delighted, because every time there's an election, and I probably made the same joke when I saw you in Haifa, but every time there's an election, they get a day off school, so they're very happy with the situation.
Yes, I think that did come up the last time we saw you. So Israel's getting a lot of national holidays out of its political chaos. Yeah. But coming back to vaccination and away from the politics, then, or maybe they are intertwined in this question, and I'm seeing a few other questions like this. You know, you focused in your presentation on sort of the under-resourced communities and communities at the periphery, the Arab citizen population, the Bedouins, the Ultraorthodox. I'm curious if you could expand a little bit about how the pandemic has informed relationships between those communities and the government. Has there been collaboration? Has there been tension? How has the government engaged with those communities? What are we looking at on the other side of this in terms of the lessons learned about those communities' relationship to the central government?
Yes, so unfortunately, I would say that the relationship with the ultra-Orthodox population, between the general population and the ultra-Orthodox population, has been badly damaged as a result of what we've seen unfold during the pandemic, because I think there was major frustration among large parts of the mainstream Israeli population that ultra-Orthodox areas were opening schools, in some places, not everywhere, but opening schools in violation of COVID restrictions. There was a lot of photos and videos that came out of gatherings, weddings, this type of thing, in violation of the rules. And that really did harm the social fabric. Furthermore, ultra-Orthodox politicians very much blocked the idea of local lockdowns, which a lot of the experts thought could have really stemmed the advance of coronavirus, and didn't want those to happen. And all of that did cause a great deal of resentment and problems. And I think that will take a while to recover from that. I think that's had a negative, a very negative ramification. Well, we can come back to that if you have further questions about that. But in terms of the Arab population, something really fascinating happened, which is that during the thick of the crisis, hospitals, healthcare centres were really being run to a large degree by the Arab population. The Arab population has a disproportionate number of doctors, nurses, pharmacists, really people that keep a country's health system running. I remember when my son decided in the thick of the first lockdown to fall over and break both of his arms, pretty much all of the care that we received was from Arab doctors. And if you think about Israel, usually in a national crisis, Arab citizens are on the sidelines. And why is that? Because the majority of Arab citizens don't serve in the army. And the main kind of crisis we're used to here is a military crisis. This was a different kind of crisis. This was a health crisis. And during the health crisis, the Arab citizens were on the front lines, out of all proportion with Jewish Israelis. And this created a remarkable dynamic, a dynamic of gratitude, a dynamic of people really coming together in praise of Arab people who were helping to keep hospitals running. There was one movie that was put online to pay tribute to Arab hospital workers. That was, I think, at one time the most viewed video in Israel. And in terms of that, I think it did kind of unite people. And the hope is that something is retained from that, that's not a fleeting moment, but rather that facing the pandemic can kind of leave some lasting mark on that Jewish-Arab relations.
First of all, thank you. And also, like, your son, oh my God, how is he doing at this point?
This was about a year ago. I think we've had all of our children in hospital at some point. He broke his arms. Another one had Kawasaki disease, and a third one ended up opening her chin. So we're just testing the Israeli medical system.
Got it. So you had a real adventure through your COVID quarantine as a family. Yes. Okay, well, I'm glad to hear that. Hopefully he's recovering, and they're all recovering. I want to talk specifically about like the NGO sector, and I think this may be our final question from the audience. Is like, as you know, we're very interested in sort of the NGO sector, and we're very connected through Boston Partners for Peace with a lot of grassroots groups, mostly those that are focused on shared society for Israeli Arabs and Israeli Jews, or coexistence between Palestinians in the West Bank and Jews, including Jews who live in the West Bank. But what I wanted to pull back is like, what has been the role of the NGOs, the community organizations and nonprofits during this vaccination process? Have there been some that have shifted their focus or found a more collaborative partnership with whether it's municipal or national government, have expanded their reach or their impact? What does that look like during the course of this process?
Yeah, I mean, Israel's NGO sector has been very vital to people's survival during the pandemic. Let's just kind of rewind from the vaccines, but really getting people through the pandemic, especially through the poverty that's come with the pandemic. There's one organization, Leket Israel, which collects food from buffets and hotels and restaurants and all these things. And their supply of food dried up entirely at the start of the pandemic, but they found themselves with more people that they needed to feed. And they really rose to that challenge, and just kind of, very tragic experiences from them. I heard from them about an opera singer who, one day she's performing, to the high of Israeli society, performing. A few days later, she literally doesn't have food to eat because her work stopped straight away. And they feed her, and they feed the hotel workers in Eilat, who are usually putting on these lavish buffets for all of the visitors, and really kind of rising to that challenge a lot of NGOs. Israel's medical services are NGO-based as well, so they've been playing an absolutely vital role in the pandemic. And I guess in parenthesis, we should say, have also been playing a vital role over the last week following Israel's largest civilian tragedy. So those NGOs are kind of very vital to operation during the pandemic here. Ambulance services, medic organizations, etc. And we also have several medical organizations that do key things like lending out medical equipment, lending out oxygen machines so that people don't necessarily need to be hospitalized with COVID and may be able to stay at home. So a lot of work going on among NGOs there. In the actual vaccination program, most of the vaccination has taken place by the health funds, has been done by the health funds themselves. Magen David Adom, which is a non-profit ambulance service, has done a lot of the retirement homes, taking care of a lot of the elderly, so they've played an important role. And also the medical service, Hatzalah, has played an interesting role, because what it has been doing is actually in association with the Claims Conference, which is which basically holds money from the German government as reparations for the Holocaust. They've been running this very important program that collects Holocaust survivors who are housebound and who can't really go out without oxygen support and full medical services, and they take them to vaccination stations and get them vaccinated. And that's been quite an inspiring program. And one of the really sweet things about this program was that as soon as they started it, they realized, hey, you know, these people almost never get out of the house because they can't go out without a medical team. And they started to say, you know what, while you're out of the house, to these elderly Holocaust survivors, where else would you like to go? And they started taking them on these little excursions to the beach or to the countryside, even if it just meant opening the ambulance and taking the stretcher out so that those people could just kind of see something outside of their own four walls. So that was quite sweet.
Well, that's a fascinating story of what I'll call it positive mission creep. And I'm going to be very curious to see sort of like how that impacts the organization and its work with the elderly and the survivors, you know, maybe 6 months from now or a year from now, if it continues to be a beach touring provider. I know that's all the time we have for today. Speaking of beach touring providers, I'm really hoping to see you soon. And I think we're all looking forward to being able to get back to our own travel and study tours to Israel, and hopefully seeing you and seeing the beaches in Tel Aviv. There was a lovely promo tourist video for Tel Aviv reopening today that I got to see. But thank you very much, Nathan, for your time. Really always very insightful, and appreciate your ability to sort of tell us what's going on and to clarify some of the facts on the ground and how different parts of society are responding. For those in the audience, also thank you for the questions from the audience. Very helpful. Got into a lot of different issues here. If you want to learn more about JCRC's work in Israel engagement, including our Boston Partners for Peace project, supporting NGOs on the ground, or our study tours, we'll throw a link in the chat. Our next speaker program will be on May 24th, again at noon Eastern time. We're going to be exploring both national and local immigration issues in the United States. Please stay tuned for more details. Your time.